Medicare is both an incredible gift to folks 65 and older and a tremendous headache to determine what the best coverage could be for your specific situation. How do you decide between supplemental plans or Medicare Advantage? Will the medicine that you are currently taking still be covered by your Part D plan next year? Today, we are covering some updates to Medicare for 2026 and then re-releasing an interview we did last year with Claris Fleming from Move Health. All right, Spencer, intro. We're going to be pretty short and then just let you get into Claris's interview from last year. But, thankfully, Medicare does not make significant changes on a year-to-year basis. So hopefully this update is going to be fairly straightforward. We're going to put a link in the show notes to the Medicare 2026 handbook where these changes are expanded upon. You can read the entire 100+ page document if you will. We're just going to cover a couple things. So Spencer, you want to talk us through the Medicare Part D drug coverage that is updated in 2026?
Yeah, we'll walk through the updates. A couple things come to mind, even just framing things for clients who have engaged with Move Health in the past or with Bernard or with Caribou along the way. Just as a reminder, for the most part, your supplement will stay the same. If you have a big desire to make a change there, you may have to go back through underwriting. Claris will talk about that a little bit. For the most part, people just need to be looking at their Part D options and reviewing those. That's the biggest place that you can go. Another thing, as we look at Medicare coming forward, is that there's two things that are kind of enhancements that are part of this year that we haven't had in the past. So when we look at the key changes, one would be that Medicare Part D, that is the prescription drug coverage, your out-of-pocket costs are going to be capped at $2,100 in 2026. So they looked at that, and legislators said, there's just too much that's being spent for prescription drugs. We're going to cap those out-of-pocket costs. So that's a really nice benefit, all told there. You do need to look at your Part D coverage and make sure that the formulary hasn't changed or that the pathway that you take doesn't need to change based on maybe different prescription drugs that you're taking or one that you added or subtracted or what have you. The second thing that's a nice feature is this advanced primary care management. So this is patient-focused care that really it tends to be with medical providers, oftentimes general practitioners, who look at more of a holistic type of approach or coverage where you might pay a monthly fee or quarterly fee to have access to a physician and who will look at a lot of different things in addition to maybe those that a general practitioner would typically look at in an annual review. So that kind of holistic care is really attractive for some folks. And so that's being added as a benefit option with a lot of these plans going forward. So with that, Austin, what else do we need to bear in mind?
Yeah, I think the big thing is with your Part D drug coverage and that out-of-pocket maximum, you need to make sure that the drugs you are taking are covered under your formulary. And so if you have an expensive drug that is not covered, then that out-of-pocket cost, I don't believe, is going to be capped. And so really, it's really crucial that you work with folks to make sure that, hey, these are the drugs that I'm taking. This is the formulary. Are my drugs covered? And so I think we want to make sure, I think Claris covers that as well in the interview, but don't really have any other updates to talk on other than when we recorded this interview last year, Caribou had not been acquired by Move Health. And so when you see the slides, you'll see Caribou's logo throughout. Now, the nice benefit is none of the things that Caribou had offered is going to change. You'll still get class leading advice and guidance for clients that they will tell you, hey, this is the entire landscape. Now, one thing that Move Health does that Caribou did not do is they'll actually help you sign up for your Medicare plan. So that's a really nice benefit that's being added to clients who utilize that service. And so we're really excited for this interview with Claris. We thought it had a tremendous amount of great information that covers last year's information, but as well just covers on, because there's thankfully not a lot that changes with Medicare on a year-to-year basis. So with that, we hope you enjoy this interview from Claris.
Today, we are delighted to welcome Claris Fleming. Claris is Health Plan Coordinator for Caribou Wealth and focuses on helping clients understand their options for health insurance. She's going to share an overview of all things Medicare. Claris and her team at Caribou Wealth are some of our core partners in providing non-commissioned health insurance counsel. For clients who want to work with Caribou, please reach out to us directly. With that, Claris, take it away.
Hi, good afternoon and welcome. This is a brief Medicare Open Enrollment 101, and I'm thrilled to be here with our partners at Retirement Planning Services. So, as mentioned, my name is Claris. I'm a health planning coordinator. Really, I like to say I'm an education enthusiast. I know that healthcare is not the most glamorous or exciting topic, but I believe that it's an important one. It's one that can affect our financial well-being as well as our physical health and well-being. So taking a few minutes to kind of learn a little bit about it and carve out time, I'm thrilled to be here and sharing that with you and helping you along your healthcare journey. So I'm part of the Caribou Client Services team, and I love this time of year. I thrill to open enrollment so we can all kind of focus on ourselves and improving our wellness and health, as it were. So what are we going to cover today? One, why is Medicare planning so important? Why should I care if I sit down and do this for a few minutes? Two, I want to give everyone an understanding of Medicare basics, like a good foundation, so that you know what you're looking at and you can confidently make these choices for yourself with an awareness of what's available and how it works. And then I'm going to guide you through how to pick the optimal coverage for you specifically. And then let's look at your next steps. So, why is Medicare planning important? Well, drug prices have increased 35% between 2014 and 2022. In that same window of time, Medicare services went up by 21%. So healthcare costs are going up, up, up year after year after year. It's getting more and more expensive. And yet, 95% of seniors with a Medicare Part D drug plan overspent for their coverage. People say, okay, what does that mean, Claris? What it means is that Medicare looked back at 2023. In the past, between January 1st and December 30th, or 31st rather, what prescriptions or medications did clients take? And because it was in the past, they could say exactly what this patient needed in a year. Then they looked at those prescription lists and looked at all the other plans available on the market and said, could they have gotten this exact coverage that they needed with a different plan or a different company for cheaper? The answer was yes, for 95% of the people enrolled in Medicare. So our seniors are leaving their money laying around on the table, and it's there for us to optimize, for us to help you capitalize the most out of your coverage with spending the least out of your pocket. And I'm thrilled to be part of that journey with you. So let's talk a little bit on background on Medicare. First of all, Medicare is always changing. Some people think it's just a thing. Medicare it's what I get, but it's actually evolving, it's growing, it's changing as our society evolves. In 1965, Medicare Part A and B were created. President Lyndon B. Johnson signed them into law. In 2003, they created Medicare Part C. Also, some people call it Medicare Advantage, and it's sold by private insurance companies. These private insurance companies are allowed to offer Medicare coverage. In 2006, the Medicare Modernization Act expanded Medicare to cover prescription drugs, also known as Part D. I always remember that, D for drugs. So it astounds me to think that my grandparents, between the years of 1965 and 2006, had no coverage for prescriptions. Every prescription they took was just cash out of pocket. And that includes many cancer-related chemotherapy drugs, which are now available in pill format as well. So it keeps changing, though. We're not done. In 2022, Inflation Reduction Act became law on August 16th. And this is going to lower the price of drugs through negotiation. It's going to hand out drug inflation rebates. And it's also going to improve the out-of-pocket maximum or out-of-pocket cap for Medicare beneficiaries. So this is an implementation timeline for that Inflation Reduction Act. When they passed it into law in 2022, they said, okay, let's not dump it on everyone at once. Let's break it out over these 6 years. And each year, a little change is going to come into place. Well, next year in 2025, starting in January 1st, we're going to have that cap of $2,000 maximum out of pocket. So if you were taking an extremely expensive prescription like Humira or Jardiance, and you were paying $10,000 or $20,000 in prescription costs each year, you're now going to be capped at $2,000. Once you hit $2,000, your insurance is going to cover the rest for the rest of the year, 100% for the remainder of the year. So this is going to have substantial impact on people's pocketbooks for the better. But there's more changes coming each year after year until 2019.
So with that $2,000 cap, is that for any of the drugs that might be offered, say, within a plan? Basically, anything that's out there that could kind of push seniors, above that? It sounds like we're going to be able to have some protection there.
Correct. It's an important caveat, and I do have a whole slide on this a little later, that it's for covered prescriptions. So if your medication is covered under your plan, that is your cap, and you don't have to go past it, which is a great financial tool for you to say, okay, I know the maximum I can spend in a year, $2,000 on prescription. Put that in my budget, write that into my financial report, I'm good to go. However, if you're taking a popular drug that's not covered, and I can name two right off the top of my head, Wegovy and Ozempic. These are called G1 inhibitors. They're injections, and they're for weight loss drugs. They're very popular right now. A lot of people are taking them. A huge percent of the country is actually taking them. They're a non-covered prescription, so their costs could go well beyond that $2,000 cap. They could still go, on and on and on and on. So if you're taking a drug that you know is not covered, we want to help you find your manufacturer coupons, your discount programs, and your services to reduce those costs down as much as possible so that they're not having a lasting impact on your financial plan. But excellent question. I'm really glad you brought that up. So aside from all the changes happening to Medicare, which we know, we change too. We might be turning 65 for the first time and enrolling in Medicare, and it's new and we've never had it. We might have a child who's in college who's aging off of our plan. They're turning 26 and they need to go and get their own health care. I see a lot of people who are retiring. Maybe they worked past 65 or they're approaching 65 and they're winding down, cutting back hours, looking at retirement. Maybe not now, but planning for early next year, spring, summertime maybe. We have job loss, retiree health benefits. You might be in a union or a group that has retiree benefits, like a federal employee program. And you might be thinking, do I take the retirement plan or Medicare? Or my company has a Medicare version of a retirement plan. Which one do I take? And then I hear a lot of people telling me that they're moving. I have so many people who've had like a vacation home and they're relocating to their second home to live permanently. So their vacation home will become the permanent and their former home will become the vacation. Some people are moving to live close to their grandkids or closer to their children. So you might be relocating or changing things in your life and need to look at healthcare as well. So let's go over the basics. I want everyone to have a good foundational knowledge of how Medicare works. First of all, it's income-based. IRMA, this is a terrible acronym, Income-Related Monthly Adjustment Amount. Basically, in a nutshell, this says that it's income-based. Just like when you guys pay taxes, the more money you earn, the higher the tax bracket you're in. IRMA, or Income-Related Monthly Adjustment Amount, is similar. So the way you read this chart, on the top in gray, you can either file individual income, married filing jointly in the middle, or you're married filing separately. Find your column, then scroll down and look for the income you made in 2022, so 2 years ago, and you're going to find your income bracket. And then once you've found that, scroll to the right. The first blue column is what you'll pay for your monthly Part B premium for Medicare this year in 2024. In the second column, the blue column, you'll find your Part D, or prescription drug coverage premium. So that's your monthly premium, and it's every month you have this income adjustment. This is just an important chart to know. First of all, they always do 2-year look back period. So next year in 2025, they're looking at your 2023 income. If you've just retired and you had like a huge banner year, maybe you sold your company or you were at the top of your career earning dollars, and now you're on a retirement income, which is lower or a fixed income, you're going to notice a difference in that income. You're going to notice your IRMA drop. You do not have to wait 2 years for IRMA to catch up to your income. You can file a form called the SSA 44, stands for Social Security Administration -44. That SSA 44 form allows them to review based on your current income and set your IRMA appropriately for what you're earning now. Or you can wait, and in 2 years, your income will naturally catch up with yourself as the 2-year rollover or look back period passes through. It's important to know these brackets because you don't accidentally want to jump a bracket by only a few dollars. Like if you're getting distributions in your retirement account or capital gains or anything like that, you don't want to accidentally take, $4 or $5 to cross over a threshold and find yourself in a whole new IRMA bracket by accident. Intentionally doing it is great, and making more and more money is fantastic news, but just be conscientious and aware of it. So, beyond the premium, Medicare has this fork in the road. On the left, original Medicare comes with Part A and B, which were created way back in the 60s, a Medigap or supplemental plan, and a Part D prescription plan. Multiple pieces to build your Medicare configuration. On the right, Medicare Advantage are those ones sold by private insurance companies, and they're all bundled together. They call it Part C, or Medicare Advantage. Both of these options include A and B. Now, Part A is usually free. It's coordinated through the Social Security Administration, and it's facility care. So hospitals, nursing facilities, hospice care in the home. If you had a lab work or x-ray or MRI, that would all fall under Part A. Part B has that income-based premium, IRMA, and it also covers your professional doctor visits. So your doctors, your specialist, if you have wellness exams or annual physicals or vaccines, and durable medical equipment. A and B only cover 80% of your costs. So let's say you have a sore throat and you go to your doctor and he bills you $100. Part B is going to cover $80 and you're going to pay $20. That's not so bad. But let's say you have something significant like a hip surgery and you're in the hospital in Part A and it's a $10,000 bill. Well, now you'd be on the hook for $2,000. And people said, no, that's too much risk exposure. What if I have dozens of health claims and bills? I don't want to be on the hook for 20% with no limit. So extra coverage was born to cover that 20% gap. So now we're going to talk about how you personalize your Medicare with additional coverage. Option 1, as I mentioned, on the left, that left-hand fork, you can add a supplemental plan or a Medigap. You can also add a Part D prescription plan for your drugs. Supplemental insurance is just like when you rent a car. I don't know if you've ever been on holiday or vacation, you rent a car and they say, do you want the roadside assistance? Do you want the prepaid gas up front? Do you want the sat navigation? Do you want this? Do you want that? Do you want extra insurance? You can add on all these other little things. It's exactly like that. You're adding on a piece of insurance to give yourself a little more coverage. Medigap fills that gap that Part A and B don't, the 20%, which is why it's called a Medigap. It's also called supplemental insurance. They're sold by private insurance companies. They have to follow very specific rules to cover that 20% that Medicare covers. And they're named by letters. There's 12 different lettered plans in most states. The common ones are F and G, and sometimes N. Now, I just want to pause. I know everyone gets confused by the letters. So, for example, we have Part A and Part B, Part D for drugs, but now we're going to have a lettered Medigap, and that might be a letter G or F or L. So we call it the alphabet soup of Medicare, and I'll show you what I mean in just 2 slides. But here's some important considerations. If a plan has the same letter, it's identical coverage. So for example, if you get a Plan G with United Healthcare or a Plan G with Blue Cross Blue Shield, they are the exact same coverage. There's no difference except one's with one company and one's with the other, but they're mandated by law to cover the same things. High deductible options are available if you want to pay a lower monthly premium but don't mind having a bigger financial risk. And there's some considerations that are specific to each state, like whether or not you can change in and out of your plan. There's age-based restrictions as well. I mentioned the Plan F is popular, but it's being sunsetted. It's no longer sold to anyone who's a new enrollee to Medicare if you weren't 65 in 2020. So this is that alphabet soup. Those are the letters across the top, all the different plans you can have for a supplemental Medigap. And as you go down on the left, you'll see what Medicare A and B do not cover. So Part A, 20% coinsurance. The Part B, 20%, because I told you that A and B only cover 80%. The first 3 pints of blood, for example. If you looked at like the second to last one, foreign travel, if you were, say, in France and you had an emergency, A and B don't cover that, but some of the Medigaps do. So look at Plan G. It's kind of along in the middle. and scroll down, you'll see Plan G covers all the green check marks. The only thing that's not covered is the Part B deductible, which this year is $240. So when you buy a Plan G Medigap, you're purchasing extra insurance on top of your Medicare, and they're going to cover everything but $240 deductible. So here's an example of a side-by-side with 3 Medigap plans covered together. ACE Property and Casualty is an A++ rated plan. The Humana Insurance is a very recognizable carrier, and it has a 12% household discount, which means if you and your wife both, or your spouse, if you and your husband both pick the same plan, you could each take a 12% discount off of your premiums. And then there's AARP United Healthcare, which is a community rated plan. If you want to see, and since these are all Plan Gs, we know they all cover exactly the same thing. You'll pay a little bit extra each month in your monthly premium. For example, the first plan is $175 a month. So you're buying additional insurance, but then the most you could pay in a year is $240 and you're finished. The insurance covers everything else. So when you add up all of your premiums together for a whole 12 months, plus your $240 deductible, the most you're spending in a calendar year is $2,349. I like to call these like a high performance vehicle. So I've been told, and I do have to preface, I've never driven a Ferrari, but I've been told that when you drive a Ferrari, you pay a lot of money because it's very expensive to buy that car. But when you take it home, it's very easy to drive. It turns well, it accelerates well, it stops well. It's just very nice. And you don't have to go to the mechanic hardly ever. The car takes care of itself. It's not breaking down on the side of the road all the time like my old used car was. So this is kind of like that. You're going to pay extra money to buy additional insurance. Then when you have that additional insurance, other than a $240 deductible, it's going to cover everything else automatically. And it runs alongside of Medicare Part A and B, and it's very easy to use, very easy to drive. It covers you, and you have peace of mind and no exposure other than $240 risk. So it's a great high performance health plan, if you will pardon the sort of analogy. So let's talk about your prescriptions. In addition to Part A, B, and your supplemental plan, you're also going to get a prescription Part D plan. And they're standalone drug coverages. They're offered by private insurance companies. They also have a premium and that IRMA, income-related monthly adjustment amount. Starting in 2025, they're going to cap your out-of-pocket costs, which is great, at $2,000, but manufacturer coupons are not allowed if your drug is covered under the health plan. So some things about this $2,000 cap. First of all, it is for covered prescriptions. If your prescription is not covered, you will continue to pay, as we've already discussed. Also, a very important note that I wanted to call out is that this new law might affect if employer plans meet the criteria to be creditable coverage. And what that basically means is if you want to waive Medicare because you're still working and you want to take your employer plan, there's a law that says your employer plan must be equal to or better than Medicare coverage in order to be qualified as creditable. If it is not considered creditable coverage, you should enroll in Medicare. And if you don't, you could face late enrollment penalties later in life. And late enrollment penalties for Part D are assessed for the rest of your life. So every month that you aren't covered, they increase the penalty amount. Whenever you do sign up, that amount is going to be applied to every single month for the rest of your retirement. So it could be a catastrophic amount. I have seen somebody who ended up with $100 monthly late enrollment penalty, and he started to think maybe it's better that I don't enroll at all because I've waited so long. So because this new law is going to affect a lot of employers, employer plans that were maybe once considered credible are not going to meet the criteria in this new cap. They are required by law to send a paper letter to notify any employee who's over the age of 65 if their plan will meet criteria or not. So everyone should get a letter. But if you get one of those letters and you don't have credible coverage, you now need to look at Medicare this year for the first time and talk about enrolling, even though you're eligible for your employer plan, if it doesn't meet criteria. So let's talk about comparing plans. Again, uncovered prescriptions, we mentioned Wegovy and Ozempic. There's no cap on drug costs, but formulary lists matter. So, for any of you who don't know, a formulary list is a list that the insurance company produces or publishes that says these are the drugs that we cover under our plan. And they differ slightly between one company and another. A company will produce this every fall and it's good for the whole year. And in this case example, this client that we're looking at, there was 4 plans. The first 3, the 2 Cignas and the AARP, covered all but one of their prescriptions. They had to pay cash for one of their prescriptions. So in our analysis, we price out not only the $2,000 cap, which we have for their other drugs, but for the non-covered drug, we say, what would it be if you paid cash price on the marketplace? How much would your drug costs look like or expand? And you can see they're around the $15,000 mark. The WellCare value plan, though, it didn't cover 2 of this patient's drugs. Might have even been 3, but there were several that didn't meet the formulary list. So when the client was paying cash for those drugs, you can see their expenses went much, much higher. So because of that, we want to caution everybody to ensure that you're getting a plan that covers as much or as many of your drugs as possible, if not all of them. So there's a prescription payment plan, more changes in Part D, a lot of changes. If you have covered prescriptions and you are reaching the $2,000, especially if if you're taking Humira or Jardiance and you're right in January, you go to the pharmacy and they're like, we'll take $700, please. And you keep paying that $700 until you hit your $2,000 cap. It's very expensive at the beginning of the year. And then you have no cost for the rest of the year. Well, new this year, you can sign up for a payment plan. So you can take your $2,000 and spread it out more evenly across all of the months. And then looking ahead in 2026, the government is now able to negotiate drug prices directly with the drug companies. And these first 10 drugs, I was telling you about Jardiance is one of the expensive ones, these are the first 10 that they are looking to negotiate first. So when you're comparing your Part D drug plans, you just want to quickly glance over, as this client did, and make sure that all of your drugs are covered on the formulary. And you can see this person, all of their drugs were covered. So their maximum out of pocket will be $2,000 max. It might be even less than that. But you also, I want to call out, you want to be specific to the dosage and the quantity. A 5 milligram pill is covered differently than a 150 milligram pill. If you take the drug once a day, it's a different prescription than if you're taking 5 a day. So you have to be very particular when you're looking at your prescription costs. You also want to look beyond the premiums. Here's 3 plan examples. That middle plan, WellCare Value Script, $0 premiums. People look at that and say, woohoo, free healthcare. I'll take the free plan, please. But what they didn't realize is that because of their prescription list, the first 2 plans, their preferred carrier was AARP United. That's the one that they like. They also liked the free plan. They're both capped at $2,000 out-of-pocket maximum. But the WellCare Value Script was actually $1,782 of estimated costs because they had a lower deductible, a $0 deductible. So even though you're paying $78 a month in your monthly premium, which is sort of the middle of the page there, you pay a lot more upfront, but there's no deductible. So when you're picking your medication up from your pharmacy, the overall financial plan that was the best financial optimization was the third plan. So you want to consider these things. You want to consider, do I want a $0 free healthcare plan and I'll pay more money when I go to the pharmacy? Or do I want to pay more upfront and then have lower overall costs throughout the year? People always ask me, hey, Claris, do I have to enroll in drug coverage? I have no prescriptions at all. I don't take anything. I'm like, great, that's fantastic. Stay healthy as long as you can. But sadly, the answer is still yes. If you don't enroll in Part D drug plan, you could face late enrollment penalties. So you want to pick the least expensive plan possible. That free plan right there in the middle, $0, that's the one. You're not taking any prescriptions. It's the cheapest possible health plan you can find, but you're going to avoid those late enrollment penalties. And just in case you get a cold and your doctor wants to put you on antibiotics for 3 days, you now have a plan that will cover it. So don't get late enrollment penalties. Credible sources of coverage. So if you don't want to enroll in Part D, if you have an employer plan that is creditable, we're all going to check that this October and make sure, but also TRICARE, VA coverage, or if your spouse has an employer plan that you can sign up on that is creditable, you can take that. Medicare Advantage plans often embed drug coverage in them. We're going to talk about Medicare Advantage second. That's the right-hand side of the road. And so you can have those, but do check. I had a client sign up for a Medicare Advantage plan, never even looked at prescriptions, and found out later he didn't have any prescription coverage. So we are going into Medicare Advantage now, the complete other side of that fork in the road. It also includes Part A and B, and often, as I just mentioned, most of the time Part D, but you want to check to be sure. It's approved by private insurance companies, and it works the same way as regular drug coverage if the prescriptions are embedded. It's just all part of the roll in one plan. They're often cheaper, Medicare Advantage plans, and they make up most of the ads that you guys are going to see. So if you're seeing ads on the buses, at the nightly news, if you're getting those flyers through the mail, everyone's bombarding you, they're probably Medicare Advantage plans because these companies are competitive. They want your business. They really want to engage with you. Many Medicare Advantage plans require pre-approval for a surgery or referrals. So let's talk about how it bundles everything together. Looking at the premiums on the left, Part A, Part B, which are the two Medicare parts that you get from Social Security Administration. Then we have the Medicare Advantage from United Healthcare Medicare Advantage bundle and your prescription drug coverage, all included together. Now, most people don't pay a premium for Part A, so I don't want this client's example to confuse you. That would normally be zero under Part A, but all of these premiums together add up to about $700, and I'll show you on the next slide what that financial math looks like. But we also want to look at network access. Since a Medicare Advantage plan is a private plan, they have their own networks. So, for example, United Healthcare will have United Healthcare doctors. Blue Cross Blue Shield or Cigna or Aetna, they have a network of doctors. So you got to go around town saying to your doctor, hey, do you take Blue Cross Blue Shield Medicare? Are you in network with Cigna's Medicare or Aetna's Medicare? So here at Caribou, we check. And this client, their pharmacy was covered, all three medications, and all three providers, but only one of their two hospitals. So they would have to make that choice. If I'm booking a surgery or a planned event, I need to make sure I go to the hospital across town or closer to me, so I can avoid the one that's not covered. So when you're looking at the premiums, I was saying all of the premiums on the left total up to about $786 in monthly fees, but the out-of-pocket cost is $6,700. Whereas we know on that high-performance Ferrari I mentioned, the out-of-pocket costs were $240. So while this AARP on the left, it's the third section of the left, is $0 compared to a Medigap plan where you're paying $175 to buy extra coverage, in the long run, the financial exposure, because your out-of-pocket maximum is so much more, is higher, up to $16,453. So this is where people tell me, well, Claris, I'm really young and healthy. I don't go to the doctor a lot. I could get a Medicare Advantage plan for free, and I'll pay for my services as I use them, like a pay-as-you-go. If I happen to twist my ankle while I'm playing pickleball or walking or something, I'm willing to have a larger financial risk for a lower monthly cost. And I'll give you side-by-side comparisons soon to show you what that means. So I was telling you, Medicare Advantage companies want your business. They really want to attract your service. So they offer additional benefits and sometimes perks to kind of entice you and dangle that carrot for you. Vision and dental services can be included, and they're not covered by Medicare in any other way. So if you don't have a Medicare Advantage plan, you're either going without or you're buying those on your own. They cover hearing aids and hearing exams, fitness programs, sometimes gym memberships, over-the-counter prescriptions, transportation to your doctor office, debit cards to purchase healthy foods, healthy utility or paying for your utility bills, and healthy brain games like apps and things to exercise your brain and mental health. Some clients love these. I had a client who had a $100 a month gym membership, and it was on the list of covered gyms. And she says, they're going to give me $100 a month and the healthcare is cheaper. I can't believe how lucky I am. I'm taking that plan. I had another gentleman who found a plan that was going to give him this debit card. And every time he purchased a healthy fruit or vegetable, it gave him like 5 cents back. And he was like, I am not giving the insurance company all of my food budget so that they can judge me whether or not I eat my broccoli. So some clients love it, some clients don't. It's really personal whether you're going to use these services or whether they're just added noise, sales tricks, I guess you could call them. So let's talk about the left or the right. Medigap plans, that supplemental plan I was telling you about, the Ferrari at the beginning, they don't change well. The first time you enroll, you can pick any plan you want. But after your first enrollment, they can ask for medical underwriting, which means your doctor fills in a whole form, tells the insurance company how healthy or sick you might be, and they can accept or deny you based on your health. Because of that one plan on the left-hand side, people don't usually switch left or right very often. If they're on a Medicare Advantage plan on United, they might switch to Blue Cross Blue Shield or Aetna or Cigna, but they tend to stay Medicare Advantage. If they're on the left and they have the A, B, and Medigap, they can change their drug plan. Prescription drugs change every year and they can go in and out of different plans. But the Medigap is kind of the stick in the mud that it wants to stay with you for life. I'm not saying it's impossible to switch. I had a client switch and went through the medical underwriting and she passed right through. I've also had clients try and get denied. So I'm just saying it's a little more challenging, and so it's prohibitive to make that change often. So with that, think not just about the healthcare you need now while you're hopefully young and healthy and actively, walking or playing pickleball, as my mother-in-law does, but think about the healthcare you might want in 20 years when you're 95 years old and maybe your silver hairs are starting to show. And let's look long term. Fixed versus variable costs. Medigap plans will cost you more upfront, but then they have a lower financial exposure, less surprise bills. $240 is very affordable. Medicare Advantage is a lower cost, if not completely free, but you're going to have a higher exposure or out-of-pocket costs. So you could have as much as $6,000, $7,000 in exposure or risk. So it's a pay-as-you-go or a pay-upfront kind of financial strategy. Access to network. Original Medicare is accepted nationwide, all 50 states plus Puerto Rico, Guam, any of our U.S. territories, and you can move and it will follow you. So will your Medigap plan. You can travel and you can see doctors. Any doctor who takes Medicare is in your network. On the right, you have to go around town saying, do you take the United Healthcare plan? Are you with Blue Cross Blue Shield? Are you a doctor for Cigna? So you have to stay within your network of your insurance company. And then Medicare Advantage plans sometimes can have authorizations or denials. They might require you to get like a pre-referral for a surgery, or they might need you to get a referral to see a specialist. Here's an example of the companies that offer Medicare Advantage plans and how frequently Medicare or pre-authorizations are submitted. Doesn't say how many are being denied, but it says how many are being submitted. Anthem is the most, next to Humana and Centene, then Blue Cross Blue Shield. All other plans combined, our overall rating is 1.5. Then Cigna, CVS, United Healthcare, and Kaiser are the least. So some companies will request more authorizations than others. The number of Americans who are over 65 is projected to double in the next 4 decades. So it's going to reach 95 million seniors by 2016. And this results in 1 million of new Medicare beneficiaries over the next 40 years. This is why those companies want your business. Everybody knows that Medicare is growing and growing fast. And if they can convince more members to sign up with their company, they're probably going to have more loyal customers for life. And I will say, just like your phone bill, your phone and internet company or your cable program, you think every year, I could change, I could go to a new program, but we never do. And you see these advertisements that says, switch now to your new cable plan and we'll give you 3 months free. And how many of us actually pick up the phone and make the switch? So that's what they're banking on. They're banking on if they can get you to enroll in their plan first, you're going to get lazy and you're going to stick with it. And they're going to have your business for many, many years, which will make that company very happy. This is not a bad thing. I say let them woo you. Let them court your business. Make them work for it. Say, what are you going to give me? What kind of perks do you want for my customers, for my customer loyalty? And let them show you all of the benefits that they have to offer so you can make an informed decision between all of your many happy suitors and pick the one that's going to give you the most coverage for the least expense. That's my theory anyway. So more than half, 51% of Medicare beneficiaries are enrolled in Medicare Advantage. I point this out because almost everyone just says, Claris, I'm overwhelmed. I've got a Medigap with 12 different letters swimming around in alphabet soup. I've got drug plans. I've got Medicare Advantage. There's just thousands of options. How do I choose? And inevitably someone will say, well, what do most people take? Tell me what's popular and I'll just go with the popular decision. Sadly, it's almost a 50-50 split. 51% to 49% left and right on that fork. So there is no popular choice. You can pick the one that's right for your healthcare needs and your financial optimization, and it doesn't matter what everybody else is doing. So let's talk about, how do we pick? How do we decide? We do full complete analysis here at Caribou, and we partner with all of our friends over there at Retirement Planning Services to analyze your options for you. And we have two columns. On the left, original Medicare Part A and B, that Medigap supplemental plan with an expensive premium, but you're driving a Ferrari, your prescription drug plan with all of your medications underneath, against Medicare Advantage, which has that $0 premium for AARP Medicare United Healthcare plus the drug costs. And you can see that estimated financial risk is actually lower on the Medicare Advantage plan. So it's financially optimized on Medicare Advantage, even though you have that nice Ferrari on the left. Ferraris are expensive. So there's trade-offs and benefits to both. Let's talk about looking at your personal preferences. There's a lot of preferences that go into them, but these are some of the ones we ask, and only some. We have lots of questions like, do you travel? Are there companies you like to work with or companies you know you hate? But some of the preferences we ask clients to tell us about is whether or not the client will say, like, I want all of my doctors covered. I don't want to switch OBGYNs. I've been with her for 20 years. I have a relationship. I'm sticking with my doctor. Whether you want a recognizable insurance company. Do you care if you have a household, big name brand company, or can you go with a new insurance company that just started last year? Do you want a low monthly cost? I don't want to pay a lot for my healthcare. I want a fixed retirement income. I just want to pay a tiny bit each month. Or maybe I want the lowest financial risk. I don't care how much a Ferrari costs. I want a really great car. I just don't want to have any surprise financial bills. I want to buy something that I know works, that runs well. A plan with a high rating. Maybe you want 5 out of 5 stars. None of these plans with like a 2-star customer service rating. And maybe you want to keep your carrier. I've been with United all my life, or I've been on Blue Cross Blue Shield. I'm very familiar and I like them. So let me show you how that plays out with these different plans. 3 different plans: AARP United Healthcare, Cigna, and Aetna. Now, AARP was this person's preferred provider, their carrier that they liked. It is the highest rated plan, but it's a more restrictive network. If you travel a lot or you have a home in another state that you're always going to visit, 3 months in this state and 6 months in that state and then 3 months abroad, you might want a PPO network that has nationwide coverage. So that might cause you to choose Cigna or Aetna instead. If you're looking at the lowest out-of-pocket amount, the lowest amount that you could pay in the event that you twist your ankle, the Cigna is the lowest out-of-pocket. However, when you calculate it in the prescription plans, and we don't show it on this image, but when we calculate it in this client's prescriptions and how much their drugs cost, the first plan was actually the lowest overall cost. So they might have more expenses in the medical side by $200, so not by much, but a little more expenses on the medical side, but their prescriptions were cheaper. So I want to show you how one analysis can differ from another. And this is an interesting thing. Original Medicare with your Medigap and prescription drug plan against Medicare Advantage. We know that original Medicare is more expensive. Costs a lot to buy that Ferrari. I keep bringing that analogy home. But the financial risk or exposure is a lot lower, $6,567. Compared to Medicare Advantage. Claris, I'm really healthy. I don't go to the doctor a lot. I don't need to pay $527 for something I'm not even going to use. I'll just put my insurance card in the drawer and never need it. So I would rather pay $397 a month, a lot less monthly costs. And if I happen to sprain my ankle while I play pickleball, okay, I have a bigger financial exposure. I have a $4,300 out of pocket, making my overall financial risk $9,072 a year. But I can pull it on a savings account or something if I need to. Since I'm not using my healthcare most of the months, that'll work out cheaper for me. But a completely different client in a completely different state, the plans worked out differently. Medicare Advantage was a lower monthly premium, as we'd expect, but the estimated financial risk was also lower, $4,561 compared to $7,000. So now your Ferrari is getting even more expensive to cover, and it's not the best coverage for you. That is because they had an out-of-pocket maximum on one of their Medicare Advantage plans that was only $500. It was an absolute gem. It was like, this plan in your county is great and fantastic coverage, and it really did work out financially more optimized for this client. So this little moral or lesson is, don't just go with whatever plan your sister, friend, neighbor, uncle, boss took. And everyone is so nice and they want to give recommendations. And your coworker wants to say, oh, I signed up for Medicare last year. Let me show you my plan. It's great. It works fantastic. Well, just because it works for them, number one, may not work for your prescription list, or may not cover your doctors in network, or may not meet your needs. But two, it may not work out the same for you. And this is true. I see spouses all the time who just sign up for the same plan because it was easier just to pick one for the both of them. Even though it's individual coverage, they pick the identical coverage, and then they find out that one spouse could benefit from another plan than their partner. So let's talk next steps. Enrollment timeline. If you're new to Medicare, when you turn 65, you're eligible to enroll 3 months prior to your birthday month, and 3 months after. So it's a 7-month window, a huge 7-month window. You can enroll in any time. When you turn 65, you want to set up your Social Security account and enroll with ssa.gov, or you can go in person to the Social Security Administration office if you want to. I do hear that there are long wait times, though. You'll get your letter from the Social Security Administration and a red, white, and blue Medicare card. That is A and B. Those are set up and ready to go. The next step is to take that card over to medicare.gov, type in your number, your Medicare number, and they're going to say, oh, is this you? And do you live here? And is that your date of birth? And you're going to go, yes, 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 it is. And then you can enroll in either your Medicare Advantage on the right, your Part C, or your Medigap supplemental plan plus a prescription Part D plan. So enrollment timelines. If you're on Medicare already, you can change your plan October 15th through December 7th. And you can switch in and out of those Medicare Advantage plans, your Part D prescription plans. You might even want to try and switch your Medigap if you're willing to do the medical underwriting. Any changes you make in this window will become effective January 1st of 2025. I should change that date. So why is open enrollment important? Well, every year your premiums change, your out-of-pocket maximums change, the deductibles change, providers may drop out of a network. Maybe they were with Cigna and now they're switching over to Aetna. Drug formularies. I can't stress how important that is. If you have an uncovered prescription, you want to know about it before you go to the pharmacy in January. Pick up your drugs and say, wait, how much? You want $2,000? And they're going to say, yeah, it's not covered under your plan. So you definitely want to know in advance that your drugs are covered under your pharmacy plan. And then your pharmacies might change. So, and this is all just in the industry. None of this takes into factoration you might change. You might have a new health need that you didn't have last year. So health planning analyses, you've seen enough of them in this presentation, the side-by-side columns that show you different plans and how your preferences can optimize one plan over another based on your needs, your budget, your finances, your preferences, and more. So your financial advisor can walk you through these considerations and talk about pros and cons of financial strategies. Are you a pay up front, set it and forget it, I don't want any financial risk kind of person? Or are you hey, I just want a low monthly cost, something easy to maintain, and I'll pull something out of the savings account if I need to cover medical care. So you can talk about these sort of risk relationships with your financial advisor. I'll pause briefly and see if there's any questions. But if you do want to reach out to your financial advisor at Retirement Planning Services, we welcome the collaboration and the conversation about Medicare and all things relating to your health.
Super. Thanks so much, Claris. It's a great presentation. We'll look forward to working with y'all as we serve clients. I think, one of the things that we've noticed with our clients in particular is the original Medicare side of things. Even for those who are not using physicians or specialists quite as much now, they like the idea that they may have more access to those in the future if they stay on that side. Of course, it was very interesting to see that you detailed 51% on Medicare Advantage, 49% on the other side, so it's an even split. We've noticed among our clients, that split towards original Medicare, that they do lean a little bit more there, but we have clients on the other side there as well.
Mm-hmm. I think the difference, honestly, the 51% versus just 50-50 split is the advertisements.
Yeah.
The people who don't know and who aren't working with us so that we can kind of educate and talk to them. Majority of Caribou clients also are leaning heavily, and by majority, I would say a good 70 to 80% are leaning on the Medicare Original with a supplemental side. But we do occasionally get those gems, but very rarely.
Yeah, super. Well, again, appreciate your walking us through all those pieces. A wonderful presentation.
Absolutely.
If you like these financial planning videos, please share it with a friend, and if you have questions, go to our website at SiriusRetirement.com. This content was provided by Retirement Planning Services. We are located in Knoxville, Tennessee. You can visit our website at SiriusRetirement.com. The information in this recording is intended for general educational and informational purposes only, and should not be construed as investment advisory, financial planning, legal, tax, or other professional advice based on your specific situation. Please consult with your professional advisor before taking any action based on its contents. Advisory services offered through Retirement Planning Services, LLC.